Hello and welcome to Talking Live. We are tackling a very interesting issue this week. We are talking about obesity and bariatric surgery, in addition to the other surgeries that are available to people who are struggling with their weight. Dr. Michael Sutker, did I say it right?
You did.
Okay, good. Is a patient preferred surgeon, and we are doing this episode with Preferred Health Magazine. Welcome, Dr. Sutker. Thank you for joining us.
Thanks for having me this morning.
So, as I told you before the show, this is kind of a new area for me. It's not something that I delve into too much. I do have a few patients that qualify in being in the morbidly obese range, but not so much. But there are certainly, when I was doing research, many famous celebrities who fall into this category who have had bariatric surgery, like Roseanne Barr, who has openly discussed it, Star Jones, who has openly discussed her surgery, Al Roker as well, Rosie O'Donnell, Randy Jackson, and they are very open about having this surgery. And we see in some cases it works better than others. Can you tell me a little bit about what you do?
Okay, so I'm a bariatric surgeon, and what bariatric surgery is weight loss surgery. Typically, in order to get onto surgery, we've done an evaluation of the patient. Usually the patients have failed diet and exercise and medications, and surgery is their only option by that point. Unfortunately, there's a stigma that goes against weight loss surgery that it's cheating. But as you mentioned, with all of those people that have had success, surgery is really, it's great. It's a perfect option for most patients, but it's not cheating. It's not a shortcut. It really helps reinforce a lot of those other things with diet and exercise. The two major surgeries that we do for weight loss are the sleeve gastrectomy and the Roux-en-Y gastric bypass. Each one functions a little bit differently, but they're what we call risk procedures, meaning they restrict what you can eat. And that's where people don't understand about surgery is they're saying, oh, well, why can't you do that on your own? Well, weight and appetite and fullness, those are all associated with a lot of hormonal changes. And what surgery does that diets don't do is they change your hormones. So they take away your appetite and they make you full quickly, what we call satiety. And so all of these things work together to make surgery just infinitely more successful than non-surgical options.
What I found so interesting, and I really did not know before preparing for our discussion today, I really thought about the sleeve or bariatric surgery, that it does restrict or make your stomach smaller. Therefore, what you can tolerate eating is less, and that produces the weight loss. But it's really a lot more complex than that, according to some researchers, that it really changes how a person experiences food in their brain, and it changes some of the other structures. Can you explain that to us in a way that's understandable?
Yeah. Okay. So if we think about the normal structure of the stomach is basically a sac that expands as we eat food. And normally as we eat and the stomach expands, it triggers receptors that send hormones out to various parts of the gut, out to the brain. And that's what triggers pleasure receptors to say, I like eating. I want to eat more of this. And satiety receptors saying, I've eaten enough. The stomach is stretched out enough. And now I want to stop eating. And so there's a whole complex system that's in play. And what surgery does is we take that big giant sac, and with the sleeve, we turn it into a thin tube, a sleeve, and it actually changes the way that your hormones react. And so even though you're a small amount of food, it triggers your satiety receptors, meaning it triggers you to get full quickly. So if I only ate 3 bites of food now, I'd be pretty full and hungry, or excuse me, I wouldn't be full and I'd be hungry all the time. After surgery, 3 bites of food and you're full and you stop eating and you're comfortable with that. So the answer is yes, you could stick with the diet after surgery without having surgery, but you'd be miserable all the time. You'd be starving, you'd be hungry, you'd be cranky. And without surgery, those effects don't ever get any better. With surgery, those all change.
So There's a certain set point that a lot of people have. It's the area your body likes to stay. So there's a certain weight set point, right? Regardless of how
Correct.
much you
Correct.
exercise. And I believe that is contributed by our genes. Is that correct?
Yeah, there's a whole complex host of interactions, but yeah, it's somewhat genetic. It's somewhat based on our diet and our activities. The way we look at weight, there's essentially three components that go into it. It's what you eat or what you consume. It's your activity, so exercise, and then the third part is what we call your resting metabolic rate. So even if you laid in bed all day and literally did nothing in terms of activity, you still need to burn calories so your heart can beat, that you can breathe, that your kidneys can work. And so with weight loss, your body wants to maintain that weight. So if you say, well, I'm going to exercise more, well, what happens with most people? Well, it triggers their hunger. And so then you eat more. And so you maintain
Hello.
that balance. Yep.
I'm raising my
Or then you
hand to
say,
that.
yep, absolutely. And then let's say you want to diet and you stop and you want to eat less. So then you consume less calories. Well, your body's basal metabolic rate goes lower. And so you burn less just by sitting there. And that's how your body maintains that set point. With diet alone, exercise alone, medications alone, it's really hard to reset that set point. That's why people yo-yo diet. You go on a diet, you
Mhm.
lose 20 pounds, you do great, you feel well, you stop your diet, boom, your weight goes back up. And probably when it goes back up, it goes up by 25 or 30 pounds, you know?
Mhm.
And what surgery does is it takes that set point. So let's say your body says, I want to be 250 pounds. You have surgery, it resets it to much lower, like 175 pounds. And so, and once again, that's where surgery comes into play, that all of these other things don't reset.
What I loved reading about were the rat studies, where, and sometimes animal studies don't always apply to human being studies, right? I mean, there is that difference, but they measured the rats that actually had the bariatric surgery versus the ones that didn't, and they're instinctual, and they did not want to eat as much, and they had a different, I guess, relationship with food, and they were able to maintain their weight without doing anything different other than having the surgery.
Yep, exactly. First of all, I have to applaud anyone who wants to do bariatric surgery on rats. Can't imagine that's a very, very, very fun and easy process. Uh, but yeah, exactly. Surgery changes people's relationship with food, how much they want, what kinds of food they want. I have lots of patients who have a sweet tooth before surgery. And after surgery, they say that just doesn't appeal to me at all. Like I don't even have the interest in having any of it. And so surgery helps to reset that and change the kinds of food that you like, the kinds of foods that your body processes. So, you know, animal studies don't always translate, but this is a pretty good correlation. A lot of people just they lose interest in food.
There was a evolutionary psychologist who was researching food and metabolism, and basically was saying it's not as simplistic as we want to think, because people can exercise and still stay the same weight, and people can diet and the metabolism slows because the body basically fears that it's going to starve to death. So it really, our body's goal is to survive. And his thought, after studying kind of primitive cultures, that it's our processed food that somehow is contributing to the obesity rate. Would you agree with that?
If we look at obesity rates in the US compared to other countries with different kinds of diets, the rates are definitely different. In the US, some states now have 40 to 45% of the population that are considered overweight, if not obese.
Mm.
Um, and yeah, it has to do with the diets and activity. So there's lots of sort of cultural, social factors that go into the obesity epidemic and why that has happened. We definitely know with high fructose, for instance, it leads to triggers to actually stimulate your appetite more. There's lots of government things that have gone into supporting the corn industry and corn syrup and why it's so omnipresent in a lot of foods. So yeah, I would agree that there's definitely something into that. It's a pretty complex discussion because there's lots of factors that go into it as to, what gets supported in terms of government funding, what gets supported in terms of government guidelines, who has published what paper and what industry they're supported by. But in
Always look at
general,
who's
you know,
supporting. Always look at who's supporting the research.
exactly,
Follow the money, because that
exactly.
says a lot.
Yeah.
Do
In
you?
the cardiac literature, there's a lot of there's a lot of information about them supporting sugar over fat,
Yeah.
and sugar and fat both play into unhealthy lifestyles, unhealthy eating, and it's not necessarily one that is better than another. So low fat foods sometimes have high carbohydrates and can be just as unhealthy for you as some foods that may be higher in fat but lower in sugar.
Mm-hmm. It really is complex, and I think that people don't really realize that. And there's still a huge prejudice against overweight people, and there are some morbidly obese people who will say, I go into a doctor's office and they'll just say, well, lose weight, that's the source of your problems, when in fact, yes, it might be an issue, but there may be other issues going on as well. And I think we see this backlash movement where women and men who might be considered obese, because really to be considered obese, it doesn't take that much. Really, we need to be pretty thin in order to be healthy, and are claiming, body confidence. What do you think about that idea? Both, the prejudice against fat people or obese people, and then certain people via social media trying to reclaim an okayness with being obese or overweight.
So lots of things to factor in based on what you just said. So there's absolutely a bias against patients with obesity. And so just framing that conversation, what is the appropriate term to use? And typically most people say patients with obesity as opposed to obese patients or fat patients, just in terms
Am
of,
I being politically
no.
incorrect? Okay, so how do I say it? I want to learn from this discussion.
So people with obesity, that, it's not their
Okay.
obesity that defines them. And so,
Yeah.
that's the first thing. And it's something that, just like anything else, is just, how we've thought about it, and we have to reframe it. And one of the other big things, especially in the medical community, is obesity was just diagnosed as or just clarified as a disease really in the last 5 to 10 years. Before that, people thought it was a failure. Just
right.
try
A
harder,
moral
do more, try
failure.
harder.
A moral failure
Exactly.
that
Yes.
these people are sitting home and
And,
eating all day.
yeah, and that's not the case. I have lots of patients who are overweight or obese, and they're doing all the right things. They're exercising, they're keeping on a low calorie, they're sleeping well, they've got all their medical problems as managed as they can, but they can't seem to lose weight. And as we talked about before with the set point, your body just wants to absorb everything, keep it in, and it doesn't want to lose weight.
Why is
The
that?
chances of
Is
success,
that the disease, Dr. Sutker? Is that
that's yeah,
the
that's
disease
yeah.
part, that the body doesn't process food the way it ideally should?
The body is designed to avoid starvation. And so all of these things are mechanisms to prevent, even though someone may be overweight, or someone has plenty of body stores in their fatty tissue, they think that, well, at some point it may not get enough. So let's store it. Let's keep it. Let's keep building it up. And so as you start to decrease those calories, your body just hangs on to them more and more.
Yeah.
And so your body just doesn't want to lose that weight. And once again, like we referred to before, surgery resets that. It changes all of those mechanisms that are just naturally innate in our bodies to help reset the weight. So even if someone tries and tries and tries, and in women who are obese, the likelihood of being successful by just trying on your own is about 1 in 700 about losing
Wow.
weight. I can tell you, and I'm sure in your practice, more than 1 in 700 people try hard. It's not a try hard kind of thing. It's we have to do other things other than just do more, try harder.
Yeah, it's so interesting. I'm thinking, just like from a psychological perspective, I'm wondering if there's any psychological perspective or intervention that can be done to switch the body's set point so that it is more in sync with being what we consider healthy now. And I don't know if there are any studies to suggest that.
I can't think of a study off the top of my head. Cognitive behavioral therapy can help with some patients. the psychological component is a huge component of when we evaluate patients both before and after surgery.
Mm-hmm.
People, a lot of people have unhealthy eating habits. A lot of people are stress eaters.
Yeah.
And after
I'll raise
surgery,
my hand
you
to
lose
that
that.
too.
And a lot of people can't do that after surgery. You can't stress eat after surgery because you don't have that reservoir. And so being able to maintain healthy stress relieving activities, coping strategies, that's all really important for my surgery patients, is to be able to withstand that, because surgery is such a huge change in your body and your lifestyle.
Yeah. And what I do think is important is a psychological assessment that is done well, because not everybody is psychologically ready to undergo this kind of surgery. And they really need to be motivated and understand all of the realities that happen. For example, I find it interesting, and I do think this kind of weight surgery should be covered by insurance companies. Absolutely. But I also wonder if plastic surgery to get rid of the extra skin, so that a person who's lost a lot of weight can feel good about their body, which I think would be impossible to do if they have all of this sagging skin. I think that should be covered under reconstructive surgery. What are your thoughts about that?
So every state is going to be different. I know New York, where you are, bariatric surgery is not allowed to be an exclusion criteria on someone's insurance policy. In Texas, it's very different. Only about 30% of people with insurance actually have bariatric benefits. And so that's the frustration that we go through, is we know something that can absolutely benefit patients, but insurance companies don't want to pay for it. And I think that goes back to speak to the bias against obesity.
Yeah.
We know long-term studies show that obesity surgery actually cuts down long-term medical costs,
right,
because you're getting rid of diabetes and high blood pressure and high cholesterol and heart disease, even preventing cancers. It avoids all of that. But from a financial standpoint, yeah, it's a big upfront cost. And so that's one of the reasons why insurance companies don't want to cover that. On the other hand, what you're talking about with what we call body contouring surgery. So it's the removal of the excess skin and fat after surgery. A lot of women can get breast reductions covered. We can get abdominoplasties or tummy tucks covered. But those aren't the only issues that people run into afterwards, is they get saggy skin in their arms and their legs and their buttocks. And we do run into the financial difficulties with those as well. Some studies have showed up to 70% of people have at least some dissatisfaction with their body after surgery because of that extra skin and fat. But only about 30% of people actually go on to having body contouring surgery later on. So it means most people are at least accepting of what their bodies are, and understanding all of the other benefits of the weight loss surgery besides just what their body appearance is.
For someone who is more like me, or more like many people who always want to lose that last 5 to 10 pounds, are there medications out there that assist both women and men with that, because of the issues that we've talked about? Body set point, maybe exercise and diet doesn't work ideally or as much as we'd like it to, or the hormonal changes that happen in a woman's life and perhaps a man's life as well.
So to take your last point first, in general, it is easier for men to lose weight than women, and that's probably based on just hormones. And
not muscles,
not necessarily.
Okay,
but I mean,
hormones.
I've done weight loss surgery in husband and wife the same day, and the man just poured the weight off, and the woman, it took longer. Now they ultimately both got down, to their goals. But it's just very different to see same surgery, same day, male, female versus what we see. So that's pretty common.
So unfair. That is so unfair.
if only we could manipulate that a little bit.
Yeah.
In terms of people who want to lose 5 pounds, 10 pounds, 50 pounds, yes, there are several medications that are approved by the FDA for weight loss. The average amount of weight loss that people experience with them is about 5 to 10% of their body weight. So they're good. I don't typically recommend them for my surgery patients because, those people need to lose 20, 30, 40% of their body weight. So the medications can
Yeah.
help as a jump start. They can help augment, but they're typically not the only treatment necessary. And even
And
though I said that people may struggle with diet and exercise alone, all of those things can work in conjunction, especially for someone who's not a candidate for surgery, is taking those medicines to suppress your appetite, decrease cravings. Those all can work together to help someone who needs to lose a little bit of weight.
And my last question is, the medications for weight loss, they only last while you're taking them, or do they last afterwards as well?
Correct, for the most part. And the unfortunate thing with the medications, phentermine, for instance, which is an appetite suppressant, your body develops a resistance to it after a while. And so a lot of times we'll put patients on it for 6 months, stop it for 6 months, start it for 6 months, and kind of go back and forth for that. And so just like your body develops resistance to dieting, develops resistance to exercise, well, yeah, it develops a resistance to some of the medications as well. To the best of my understanding, people may maintain weight loss after they stop the medications, but typically they don't continue their weight loss after they stop the medication.
This is so interesting. Where can people find you if they feel that they are in this category where they need some surgical help to help them lose the weight that might make them sick in some way, or they're just really motivated to make that change and they weren't able to do it on their own?
All right. So you can check me out on my website, which is www.michaelsutkermd.com. Have a Facebook page, have an Instagram page as well. I'm happy to help educate and answer any questions that anybody has.
Well, you have
we always try to be
certainly
open, accessible to everybody.
Well, you have certainly educated me, and I am so grateful for that. And we will make sure to have your website up and all of your social media channels so other people can find you and be educated by you as well. Thank you so much.